Hi, I'm Dr. Bryan DiMarco here at Renew Dental. We get a lot of questions from our patients about same-day crowns, so I'm here today to answer a few of those questions and help to give you a better understanding on the subject. So first off, patients will ask, what are same-day dental crowns? So essentially with the same-day dental crown, it's the same as a normal crown. So a crown is basically a little helmet or covering that goes over the top chewing part of your tooth, and it helps to protect it and hold together so it doesn't break apart. And with the same-day crowns, that simply means that we can do the entire process from start to finish in one appointment on the same day. So what are the alternatives to same-day crowns? So more of a traditional crown, or how the appointment usually would go, is that it's done in 2 visits. So typically the first appointment, the dentist would prepare the tooth for the crown. They would take the impression or the scan of the tooth, and then they would make a temporary crown that would go on the tooth. Then they would send that scan or impression off to the lab. They would make you your crown, and then about 2 weeks later, they would get you back in for a second appointment in order to put the permanent crown on the tooth. So the next question we get is, what type of dental crowns are there? So there's a few different materials that crowns can be made out of. Your kind of older school or traditional crown can be made out of gold. You can also make it out of porcelain and metal. Or with our same-day crowns, we make them out of porcelain. So we have 2 options. We can make it out of a porcelain material, which usually gives us a higher level of aesthetics, so it looks a little bit nicer, looks a bit more like a natural tooth. Or we also have the option of doing what's called a zirconia crown, which is basically a stronger material that we can use in back teeth for people who have a really heavy bite and where that crown might be more prone to breaking. So patients will often ask me, is a crown necessary after root canal treatment? So when it comes to root canals, the root canal itself does make the tooth quite brittle and more prone to breaking. When you have a root canal on a back tooth, so either a premolar or a molar, it's always going to be recommended that we put a crown on that tooth. The reason for that is those teeth are doing the majority of our chewing. So day after day, you're doing about 80% of your chewing on those back teeth. The heavy forces that are involved with that can lead to the tooth breaking, and that's why the crown will help to protect it and help that root canal on that tooth to last. When it comes to a front tooth, it's not automatic. If you have a root canal and if it's a relatively small hole that was made in the tooth or a small cavity that required the root canal, then we usually can fix it with a simple filling. Once the tooth starts to get more involved, like you had a very large, maybe a break or a large cavity, and now that filling is going to be very large, at that point we might discuss doing a crown, because the crown is stronger and will help to maintain the longevity of that tooth. So patients will ask, can you explain the same-day dental crown procedure? So what is usually done is on the day of the appointment, the patient is going to come in. First, we're going to give them some numbing to get that area numb so that they're not feeling any pain during the appointment. The next part of the appointment is going to be removing any old fillings or cavities or any issues with the tooth so that we have a nice clean tooth to work with. We're then going to do what's called the dental core. So that is basically putting a filling material inside to fill up the gaps where that cavity or the old filling used to be, so that we have a good base to put our crown on. Next, we're going to prepare the tooth. So we're going to shave down that filling that we put in and then any tooth structure that we need to, so that we have enough room to put the crown on the tooth. Next, we're going to take a 3D scan of the tooth, and we're going to use that scan in order to design and make your crown. So on the software that we have, we're going to start to design your crown, and we're going to make it perfect so that it fits inside of your mouth. Next, we're going to have a break in the appointment. So it usually takes us about an hour to an hour and a half, maybe at most, to make the crown. So what's involved in that is that your crown is going to get milled. So we use a porcelain block and a machine that uses burrs that cut out the crown from the block. And then once that's done, the block then goes into the furnace so that the porcelain can harden and reach its final state. After that, we then will take that crown and we cement it onto the tooth, and then you're done for the day. You have your permanent crown and you're ready to go home. So patients will ask, does the same-day dental crown procedure hurt? So typically with the procedure, we are going to be giving you numbing so that you're not feeling any pain during the procedure. There is a little bit of a pinch, of course, when the needle goes in initially to do the numbing, but after that, we don't want you to have any pain. During the procedure, we typically will re-up or give you a bit more of the freezing so that you remain numb throughout the entire procedure. We don't want you feeling any pain. Just as with a normal crown or any crown procedure, the tooth itself can be a little bit sensitive after the treatment, or the gums around the tooth can be a bit sore for a couple of days, but nothing that usually is not manageable with some Advil or some Tylenol after the appointment. So patients will ask, are there any consequences for getting a same-day tooth crown? So when comparing it to a traditional crown, there's no consequences in terms of you're getting an inferior product. In my opinion, a lot of the times we're able to get a better product, and a lot of the times it's a lot easier for the patient because they don't have to go home with a temporary crown. The problem with the temporary crowns is a lot of the times, because they're not as strong, they end up breaking or falling off, and that then requires additional visits where the patient has to come back in until that permanent crown is ready to go. The other big benefit of the same-day crown is that we only have to do all the freezing and the procedure on one day, so you only have to go through that experience once, whereas with the other crown, you have to come back in twice, which generally involves getting frozen both times, that area being sore from the needle, and having to recover twice. So patients will ask, will my same-day crown look like my normal teeth? And the answer is yes. Most of the time, we can get them matching quite close to your natural teeth. Because we're using that porcelain or zirconia material, it is the same shade of the tooth, and a lot of the times it can match in quite well with the teeth. We try to do our best to try to match the shade as close as possible to your natural teeth, so that when you're talking to someone, it's not as visible that you have a dental crown on that tooth. So patients will often ask, can you get cavities on the same day crown teeth or in crowns in general? So unfortunately, the answer to that is yes. Anytime we have our natural teeth in our mouth or teeth with fillings or crowns, they can be vulnerable to getting new cavities. When it comes to same day crowns versus traditional crowns, the ratio of getting cavities is very similar. The benefit of doing the same day crowns is that because we're using very accurate equipment in terms of the scanning and the milling, is that the crown tends to fit very well to the tooth. And when we have that tight adaptation to the tooth, it does decrease the amount or the risk of you getting cavities underneath. Of course, a lot of this is going to depend on, no matter how good the treatment is, how are you taking care of it at home? So brushing twice a day, flossing once a day, coming in regularly for cleanings is going to help to increase the longevity of your treatment. So patients will ask, how should I take care of my dental crown? So as I just covered, main important thing for me is how are we maintaining the oral hygiene around that tooth. So where the crown meets the tooth is called the margin of the tooth. That is the weak point of the crown and the most susceptible part to it getting cavities. So the way that we want to kind of keep that clean and prevent a cavity from happening is by removing the plaque and the bacteria that's on the tooth. So the main ways to do that are going to be brushing our teeth twice a day for 2 minutes at a time, flossing at nighttime before we brush, and then coming in regularly for cleanings. The other way that we can maintain and help to extend the lifespan of our crowns is just being careful when we are eating food, especially really hard food. We don't want to bite down really hard on those porcelain crowns or any crown in general, because the materials are only so strong, and that can eventually lead to them breaking, which then needs to be replaced. So patients will often ask, how long can I expect a same-day dental crown to last? So when we look at the literature for crowns, on average, they usually will last about 10 years. The number one reason that a crown is going to fail is because you get a new cavity that forms around it where the crown meets the tooth structure. So the better you're able to keep that crown clean and coming in regularly for regular cleanings, usually the longer that crown is going to last. When we're looking at lifespan, that 10 years is an average though. So sometimes we'll have crowns, that last 15, 20 years, sometimes ones that last less, but that usually is the normal average lifespan of a crown. So patients will often ask, does my insurance cover same-day crowns? So when it comes to same-day crowns and billing insurance, it's exactly the same as the codes that we use for regular dental crowns. So if your insurance does have what's called major coverage, which crowns fall under, then yes, you would have coverage for a same-day crown. So how can you go about scheduling an appointment for a same-day crown? So usually if you're a new patient, you would just give our office a call, or you can send us an email or submit a form on our website, and we'd be happy to see you for an examination. We then would take a look at your tooth, take some x-rays, and make sure it actually needs a crown. And then from there, we would discuss the fees and look at booking an appointment for you. So I hope I was able to answer some of your questions about same-day dental crowns. If you do have any further questions, or you are needing a same-day crown and want to take action, please feel free to reach out to us and give us a call at 204-817-6768, and we'd be happy to help.